So, you know, we often talk about a shortage of certain professions, of skills, sometimes of doctors, concerns, for example, what will happen if we can't give enough people medical care. Also, huge worries now about a shortage of veterinarians, vets. And the wellness of animals really matters. Look at the problems we've had in getting eggs at the moment because of the avian flu epidemic. Dr. Nomfundo Mnisi is the board chair of the Health and Welfare Sector Education and Training Authority. Dr. Mnisi, good afternoon to you. How bad is the shortage of veterinarians?
Good afternoon, Stephen, and thank you for having me, and good afternoon to the listeners. Well, it is as bad as the price of eggs. In short, if I can put it like that for an ordinary South African. So we do not have enough veterinarians to take care of the animals. In a space of having to, when you must have one veterinarian per 400 animals, we have one veterinarian per 4,000. So like you'll say that we are in the shortage of 1:10. Now, this comes from a number of factors, noting the background of our country, you know, the orientation that people have in terms of taking care of livestock and animals in general, and also the awareness that is there. Veterinarians and para-veterinarians are often called doctors of dogs and cats, whereas that is not the true reflection. They are doctors of animals, including livestock, and livestock which includes food-producing animals. So that then creates a challenge in that there is not enough professionals to take care of these food and producing animals, with the resultant that we then get these animal disease outbreaks like we are experiencing avian influenza now.
Why is there such a shortage of vets? Are we not producing enough? Are some people leaving?
Oh, both. We're not producing enough. And the few that we are producing, they tend to go to the small animals, and some of those that we are producing, a third actually they leave the country to go to other areas, and those that remain, they tend to be centralized in urban areas. So out in the rural areas, we do not have the professionals to take care of the animals there. However, the other issue is that there is not enough awareness, not producing much. What the underlying factor being that there is not much awareness with the whole community about this profession. When you have a grade 12 learner who's doing math and science, they'll rather do this other lucrative careers than doing veterinary science. So what we are doing as the Health and Welfare SETA, we are encouraging learners that please do take sciences and mathematics, pure mathematics in secondary school, so that you can have veterinary science as your career of choice. So that encourages, that helps, so that we can have this career being encouraged at an early level. The other awareness that we need to make is the community itself. If a person has to choose between taking care of an animal and buying meal for dinner tonight, they'll rather buy meal for supper tonight than to take the animal to the vet. So these are the you are facing. And
Dr. Mnisi, I'm sorry, we're almost out of time, but do we need to also maybe have another veterinary school? I mean, for years, people would always only talk about Onderstepoort. Do we need to actually have more institutions that produce vets? We clearly need more vets.
Certainly, Onderstepoort only produces veterinarians and veterinary nurses. There's animal health technicians. There's veterinary technologists. There's a lot. So we need a school that will be integrative, that will consider all the other para-veterinary professionals, because it is not cost effective to have a vet per area. However, you can have a paravet in an area. It costs less to have a paraveterinarian than to have the fully fledged veterinarian. Paraveterinarians are those that concentrate on a section of the veterinary profession. So the second faculty will really assist in this, in that we will have now people who are attending, who are training on different disciplines of the veterinary profession, and will be able then to distribute them to where they are required. And that is what the SETA with the Department of Higher Education and Training are working on. Actually, it is the second faculty is manned by the Department of Higher Education and Training, so we are working together with them, with the Department of Agriculture nationally, to ensure that this faculty is we do it in collaboration, and it integrates the needs of the country. So we want a faculty that will produce what the country needs, produce the professionals that will serve the needs of the country.
Dr. Nomfundo Mnisi, thank you. Chair of the Health and Welfare Sector Education.